And out of this, there is chaos and confusion this morning at the CDC, the Centers for Disease Control. The White House says the head of the agency, this woman, Susan Monarez, has been fired because she didn't align with the president's Make America Healthy Again agenda. But Monarez is refusing to step down. Her lawyers claim she wasn't legally let go because only President Trump himself can fire her. Dr. Amesh Adalja is a senior scholar at Johns Hopkins Center for Health Security and joins us now to talk about what this means for all of you. Dr. Adalja, good morning. What do you make of what's happening at the CDC, not just today, but during the Trump administration with a quarter of its staff cut?
It's complete chaos, and that chaos is not just political chaos. It makes all of us in the world less safe. The CDC is the premier public health agency in the world. They are what we need to respond to pandemics, epidemics, emerging infectious disease. And when they're in disarray because of all the politicization and RFK Jr.'s meddling, all of us are going to suffer from it. And I don't know that the CDC can recover from something like this. It is really decimated right now.
I want you to give us some details from what you've just said, because there's several other CDC officials who have resigned, and some viewers may see these headlines and think to themselves, I'm not really interested in politics. I don't want to look at every twist and turn of the Trump administration. But explain why every one of our viewers is impacted directly by what's happening at the CDC.
The CDC is 24/7, 365 listening, looking, trying to understand what health threats might be coming to the United States, tracking multiple disease outbreaks, tracking avian influenza, tracking coronaviruses, tracking the threat of bioterrorism or biological weapons use. All of that is what the CDC does. You may not see it. You may have the luxury to not really worry about that stuff, but the CDC is doing that all the time. And when they're not doing it, bad things happen. Things will get through. Things won't be noticed until it's too late. So the CDC is our front line at the defending us against the microbial world and all those microbial threats, from the mundane things like foodborne illness to the use of anthrax as a biological weapon. That's what the CDC does. And we need the best of the best working there, the strongest and brightest minds. And we need it to be done in a way where they're not being interfered with by politics. And increasingly, the CDC has been politicized, and this is the culmination of that. Seeing the CDC director sort of fired by RFK Jr. and now multiple directors underneath her all quitting because this environment is not conducive to actually doing a good job. No one wants to work in this type of an environment, and that makes us all less safe, not just in the U.S., but remember, this is the whole world that the CDC deals with.
Yeah, and our medical contributor, Dr. Celine Gounder, this morning on an editorial call made the point that it's the centers, plural, of the Centers of Disease Control. It's not just one place, but many, many different specialists, many different arms around the country. You made the point about fighting things like COVID. There is some updated COVID vaccine guidance from the FDA. Can you help us understand what that is and what you make of it?
Well, the big thing is that the new updated vaccines have been approved by the FDA, so these are going to more match the strains that are circulating. But what did happen as well is that it's going to be increasingly harder for children less than 2 years of age to get COVID vaccines. If they have a high-risk condition, it's going to be easy for them to get it. But we know that children, even if they have no high-risk condition and they're less than 2, have a high rate of hospitalization, have a high rate of going to the emergency department. Those individuals are not going to be as easily able to get the vaccine. And that's going to cause a lot of problems because doctors may have to prescribe it off-label. Pharmacists might not be able to give it. So there is a lot of confusion right now with how the COVID rollout is going to go in the fall. The CDC, however fractured it is going to have to weigh in on that. We'll have to see exactly what happens. In the meantime, other organizations like the American Academy of Pediatrics are really putting out their own guidance to try and help figure out how to for parents to navigate this issue with COVID vaccines in the pediatric population. Yeah. But it all remains to be seen and how insurance is going to cover it. That's all something that's been completely disrupted right now.
Well, we hear the urgency in your voice on this and everything that's happening at the CDC. We hope our viewers pay attention to what's going on. Dr. Amesh Adalja, thanks for your time.
Thanks.